Now, let's move on to the information revolution. Health Secretary Andrew Lansley's vision for providing users of the NHS with access to what is called relevant and well-structured information to inform them and to help them make those choices. It's also about really helping clinicians find the information and data that they're going to need using digital technology to join things up so that it can be shared. I suppose that NHS Local itself is part of that evolving technology. Now, Dr. Andrew Coward, I've already heard you speak about the way technology is going to change things. In this new world, you will have control of the money, but are you confident you can get to the information that you and your patients need to make those good choices?
It's certainly a very complex area. Clearly, as a GP, we want our patients to receive the best service. Hospitals produce a whole variety of metrics about their performance. It can be very difficult though, can't it? Because one surgeon might be performing more complex surgery and inevitably having a higher morbidity and mortality compared to another surgeon.
But it'll be your job, won't it, to explain those figures, that data to patients so it has more meaning, I suppose?
Yes, I mean, we're already well adept at explaining to patients that the pros and cons of certain treatments, interventions, but there's no doubt that there is a huge challenge out there. Patients will have access to more information about our own services in primary care and secondary care. Maybe it's certainly very challenging. I don't think we've cracked how to do it yet. I think the principle that we should do it is the important one.
I do remember going to a GP once and him saying to me, for God's sake, don't Google it. And I mean, you know, information is power, but is it? What do you think, Sue? Information is a double-edged sword, isn't it?
It certainly can be, and I find it very frustrating that the UK is so far behind what many other countries have achieved. Certainly in terms of patient records, you know, the long-awaited, but who knows when it will arrive, online patient record. I think Norway's about to introduce their third iteration of it, and we're nowhere close yet. Right. There are huge inefficiencies in the way that some clinicians work with patients. For instance, clinicians visiting people in their homes who are still writing notes about what they've done and coming back to the hospital and then entering it into a data system that then doesn't talk to the data system somewhere else. There's a long way yet to go, if you get onto the newest technologies, the NHS won't allow us to use Twitter. So, you know, I'd love to have Twitter sites and be communicating with patients by that. But my security guys in IT say no can do. Silly, isn't it?
So there's a long, long way to go to kind of break down those barriers. Can I ask you, Ian, information is often in a large number of very separate silos, isn't it? And individual clinicians have data, public health observatories have data, the internet is teeming with the stuff. Wikipedia, Google, NHS Direct, so many different sources of information for patients, for clinicians. How can that be shared better? I mean, actually, should it be shared? Is there going to have to be some quality control on that data?
Well, of course. I mean, some information on the internet is complete rubbish. Again, a few years ago, I remember a patient telling me that they'd read on the internet that the best cure for psoriasis was tomato sauce. Not eaten, but actually spread on them. And that they'd found that as supposedly an evidence-based article on the internet. So we do have to be careful. And what we need to make sure is that the NHS is providing evidence-based information, where possible, it's not always possible, evidence-based information to patients to allow people to make informed decisions. So that's information about treatment pathways that may be available, not so they can say, doctor, I want this, I'm having this, but so they can have an informed discussion. But I think most importantly, yes, waiting times matter to people, we know access times matter, but what matters much more is outcomes, clinical outcomes. I would be happy to travel 50 or 100 miles if I knew I was going to get a better outcome from a centre of expertise than I was from my hospital locally, if that may not be quite as good in terms of a particular specialist procedure or specialist technique. We haven't yet found a way of getting that information available to the public in an easy manner. Exactly the point we've heard here. Cardiac surgeons have done it. You can find risk-adjusted morbidity and mortality information for every single cardiac surgeon in the country. The challenge now is to do that for every specialty.
Jenny, when you speak to patients and also from your own experience, is the information revolution going to transform the care that they can choose on, or the choices that they make?
I think it definitely will. I think it already is. I mean, I used to work as a specialist nurse, and I remember the differences of people bringing in different articles was amazing, because I worked in rheumatology. Obviously, anyone can do anything with arthritis. So, you know, everyone has got arthritis in the family, and everyone knows what to do best for it. And everyone bringing their little articles that came on Google and all done it. And it was just amazing. The changes in 10 years was just unbelievable. And now, even for our group, we're about to do a Facebook page, so people can come back straight to us. We're talking about Twitter, only with my GP this morning, about doing a Twitter page as well. So I think those sort of things are going to change things dramatically, and access so quickly. I think the other thing is it's the speed of access that you've got now that you didn't have before. I mean, like, as I say, you know, if you've got a Facebook page, someone's going to see that the same day. Your GP might see it the same day. Whereas before, you know, you might wait 2 yeah, it could be months, exactly. And so I think it's really important. But we need to keep up with it. I think that's the problem.
Can I just move this over to the audience? Paul from the Royal College of Nursing. When you hear discussions about the information revolution, do you think that's fantastic, my nurses will be dealing with empowered, informed patients, or do you think differently, that it's actually not going to be liberating?
I think it's very mixed, and I think to make a bold statement, I think for the middle classes it's a great thing, and all that information. I mean, Ian says, you know, he's prepared to travel 100 miles for the right care, that he finds out about, you know, where the best practice is. One, it's extremely difficult to find the information on the internet about what's happening in the different hospitals. If you don't know about the CQC, the Quality Care Commission, and where the information is, it's very difficult to find where the best practice is. It's difficult to interpret the data. Somebody needs to help people to do that. But equally, it's about a cost matter. If I'm if I'm working as a healthcare assistant on a low wage, for example, and my family have healthcare issues, it's not easy for me and the family to pick up and travel 100 miles. The choice might be there. The IT, you know, I might have the access to the information. So what we may get is that I would hope that the public start demanding in the area they live better quality care, which is what part of the QUIP agenda is about, really, is about how can we demand that better quality care. And I think the other issue for me around IT is how do we talk about Facebook and Twitter. Actually, the amount of resource that you need to put into managing those discussion sites is enormous. So we're already talking about an NHS that's trying to save money. Actually, you have to have people monitoring that all the time. With clinical staff. Or you'll get people, exactly, putting up the tomato ketchup examples, which will just be really difficult for us to manage. And messy. And messy. And we're seeing sites like the patient opinion site. Because people are not getting it, they are doing it themselves. And actually what they're doing is saying very personal stuff. I went to this ward and this was my experience. Because people do want to share that with one another, and they're using that as part of their guide as well. So how can we capitalise on that and work with the public to say, how do we package this up in an IT way? And, you know, there are great opportunities, for example, around delivering care through telemedicine. So how can we, you know, there's really good examples of where nurses are leading that kind of work. So how can we really, again, capitalise on that? So I think it's what was said earlier, is it the glass half full or half empty? It's both, actually, and we just have to manage the risk around it, I think, really well.
Can I ask Dr. Liz Hughes, now from the kind of perspective of the kind of training that is going in to produce nurses, healthcare professionals, doctors, who really know how to use technology to the best advantage of the healthcare they provide. Is it there? Is it happening?
Well,
Do you learn how to Twitter?
Actually, yes. But I think, you know, that it's clearly, as we've gone through this technology revolution, you know, the people who are coming up now through medical school, through being trained as nurses and healthcare professionals, are so proficient in all of this technology. You know, it does put some of us oldies, you know, to shame. But I think that it has an enormous potential that we can utilise, not only in evidence-based care, but also taking on, for example, in the digital lab in Warwick, into simulation and in preparing patients for surgery, showing them what's going to happen, allowing the surgeon to prepare 3D models, understanding what they will do. So I think we've got an enormous capacity in the future to actually deliver really high quality healthcare training with the digital revolution, something we couldn't have even imagined perhaps 10 years ago.
Can I put this to Leanne Brooks? You're from Unison. Do you think that your members are being given the right support within the workplace to be able to acquire that confidence with technology, to be able to support patients who maybe can't access that very easily for themselves, so that it is a positive thing for more people than just the middle classes?
It's patchy. You know, a long time ago, there was this thing that everybody had an email address in the hospital so that they could access information via the web. But not everybody had access to a PC, either at home or in the hospital. So it was patchy. It's not equitable for everybody. Some of the staff were not given the training, you know, really were technophobes and, you know, never had the time, were never given the time at work to do that, didn't have the time at home because they didn't have a PC. So it's still patchy. And there are still staff that, you know, do not know how to use a computer.
Can I ask Faye, what do you think about people who don't have the advantage of high-speed broadband access, or the confidence to use it, or the money to pay for it? Are they going to be excluded, do you think, from healthcare choices?
No, because I think we can actually take things to patients. I mean, if we, I'm thinking, as Leanne was talking, I was thinking about the nurses who I know whose workplace has given them a Blackberry, and they've got information on it about the patients that they're going to see, and they can send messages here and there. They don't have to go back to the office, pick up written records and faxes and things like that, and they can look things up. So there's a lot of portability now, and it seems to me, in the same way that we can take in, you know, we can take a commode into someone's home, or a special bed, or equipment. Well, we could take in a PC, can't we? There's, you know, all this sort of thing. So someone could be linked up temporarily. Now, you do then need people who can use it. But I bet if the elderly lady who's gone off her legs that Dr. Cowd was talking about, I bet her grandson knows how to use it, or somebody. I mean, I'm being a bit facetious. I'm sure I heard that the fastest growing group using computers is retired people. And I think we should encourage that. It does empower people. In terms of work, it's actually easy to learn how to use things if you're given the opportunity and the training. We have, in my organisation, we employ people not quite off the street, but we take people who have very basic qualifications and train them as healthcare support workers. And we are a paperless organisation, so we don't use paper records. Generally speaking, it's all done on the computer, and even people who start off quite frightened of it, actually, if the investment is put into the people, then yes, they can use it, and then they can take off with it and find what it's useful for.
Can I put this to the two people who are maybe at the beginnings of their NHS careers? Dr. Anna Hughes, when you hear of people talking about the use of Blackberrys, the use of digital technology to be able to transform patient care, is this something that you say, well, yes, of course, we've grown up with Facebook, we can see how it's going to be used?
I don't know. I mean, I work in this hospital, and already we have PDAs when we do on-calls at night time, and that gives us information about the patients that we need to see in order that we can prioritise the jobs that we have to go and attend. And that's great, but they're so slow, and not everybody knows how to work them. So I think, in theory, it might be a good idea, but I think it's got a long way to go. And I think, like everyone's saying, everyone needs to be trained in it, and we need to make sure that the technology we've got is good enough.
Francis Carter, is this, have you been trained in using Blackberrys and PDAs to access care, access
Blackberrys
records?
as such. I mean, in this trust here, we use a PIC system for all our medication, and our like Waterloo and Must tools are all on the systems. You have to be able to use it, and it's a little pen, and you have to move it about. So that can be quite hard to get your head around, and the doctors use it for prescribing stuff, and messages flag up left, right and centre. So, but all through our university course, everything is on the internet. All our course, the lectures are on websites,
It's
and
part of the way that you learn.
all your assignments you type. You don't write anything, apart from your exams. So we sort of learn all the way through our training. We have simulation, we have Sim Man, which we practice. He talks to you and you can do things.
He sounds
and
great.
It's fabulous. But yeah, loads of technology all through our university course, and then obviously in the hospitals you learn to use all the machines, and all our observation machines are electronic, so that's all learning and it continually picking new things up all the time.
But you're all young, aren't you? Yeah. And presumably people who are used to technology learn quicker on it. Vicky, can I ask, and I know that one of your GPs is sitting behind you.
Just wondering whether you're coming to me because I'm not young.
No. No, I'm going to move on quickly. No, what I'm going to ask you is whether you feel that the GPs that you manage are actually comfortable with technology, that you can see that being something that will make their jobs easier and make patient care better.
Absolutely it does. At my practice, we have really embraced technology over the last few years. We're a 6-partner practice, and out of those 6, I would say that there are different partners at a different level of computer literacy, if you like, but all of them manage to go with the changes, and some of the changes over the years have been to a new clinical system, and in Solihull the vast majority now of practices are moving on to the same clinical system so that we can talk with each other and share best practice and so on. If we have a patient go to Badger, there is no paper involved because it integrates with our clinical system. We have digital dictation systems. Our patients book online, send us inquiries online, put their prescriptions online. So we've had an awful lot of increased technology in the last 3 years, I suppose.
Can I ask an honest question of everybody here who provides healthcare? Can I ask you, do you believe that everybody will have kind of equal access to this improved healthcare, irrespective of, you know, whether or not they have a computer at home, whether they're sort of internet savvy, or is it going to be a divider? Professor Gupta.
I don't think that, you know, we all in the NHS are savvy about computers because we've been, grown up into this. It's been shown, in fact, that we are less efficient now than we were in 1970s because of the computer systems. We spend more time looking at emails that are junk emails, and we want to address issues. Whereas in the past, you know, we had slide rules, and we were actually much quicker at slide rule calculations than we are now using calculators.
But you honestly wouldn't advocate a return to slide rules, would you?
Well, I mean, the issue is that we might be good at this, but it's not potentially affecting the patient's outcomes. And I think that I don't have, in my clinic, patients coming along with sheets of paper saying, I want this following treatments, because there's a lot of rubbish on the internet. They are confused about it, so they go to the GP to say, actually, what do I need to do? Hence, come to a specialist. And I don't have 100 patients out of 120 who've come along with well-equipped knowledge about what treatment is best for them.
So it could potentially be a divider for patients. Yeah. Can I put this to Dr. John Wilkinson?
I think I agree with a lot of things that Janesh has said, but we've had... our practice has had an internet website for probably about 10 years now, and we've done internet booking probably for about 7 years. It was in its infancy, and it's now really well developed. And one of the things that people said to me, well, it'll only be the young people using it. But in fact, there's a significant portion of the people using it now who are actually elderly, and I'm talking about people in their 70s, 80s, and I think we've got one 90-year-old who uses the internet. And so I think just to say that, you know, it's going to exclude certain groups isn't always true. I agree, there will be people, you know, we live in quite an affluent area anyway, so it's quite well educated.
Dr. John Wilkinson, all of you, thank you very much for making our information revolution conversation so energetic. Thank you.